This video will satisfy the required training on bloodborne pathogens for school district employees and BOCES employees. Here's a look at some of the topics we'll be covering in this course. So why do you need this training? Well, in 1991, OSHA issued the Bloodborne Pathogens Standard, which applies to all employees who can reasonably come into contact with human blood or other potentially infectious bodily fluids in the course of their job activities. The purpose of the standard is to minimize or eliminate occupational exposure to disease-carrying microorganisms or pathogens that can be found in human blood and body fluids. OSHA has mandated that annual training is required for all employees with potential occupational exposure. This means if there is a reasonable possibility an employee might be exposed to blood or other potentially infectious bodily fluids, they must receive training to minimize or eliminate the risk to potential exposure. So what are bloodborne pathogens? The primary bloodborne pathogens are hepatitis B, hepatitis C, and HIV. OSHA has determined employers can minimize or even eliminate occupational bloodborne hazards by developing and enforcing a combination of exposure control strategies, which work for all bloodborne diseases. Hepatitis B is a liver disease caused by the hepatitis B virus. It ranges in severity from mild illness lasting a few weeks, which is acute, to a serious long-term or chronic illness that can lead to liver disease or liver cancer. In the United States, an estimated 800,000 to 1.4 million people have chronic hepatitis B virus infection. Many people don't know they are infected or may not have symptoms and therefore never seek the attention of medical or public health officials. Hepatitis B can be either acute or chronic. Acute hepatitis B virus infection is a short-term illness that occurs within the first 6 months after exposure. Acute infection can, but does not always lead to chronic infection. Chronic hepatitis B virus infection is a long-term illness that occurs when the hepatitis B virus remains in a person's body. Chronic hepatitis B is a serious disease that can result in long-term health problems and even death. A vaccination to prevent hepatitis B infection is available. Hepatitis B virus can remain infectious on environmental surfaces for up to a week in the form of dried blood. This means you must always treat blood, wet or dry, as infectious. Hepatitis C is a contagious liver disease that results from infection with the hepatitis C virus. It can range in severity from a mild illness lasting a few weeks to a serious lifelong illness. Hepatitis C can also either be acute or chronic. Acute hepatitis C virus infection is a short-term illness that occurs within the first 6 months after someone is exposed to the hepatitis C virus. For most people, acute infection leads to chronic infection. Chronic hepatitis C is a serious disease that can result in long-term health problems or even death. There is no vaccine for hepatitis C. The best way to prevent hepatitis C is by avoiding behaviors that can spread the disease, especially injection drug use. An estimated 3.2 million people in the U.S. have chronic hepatitis C virus infection. Most people don't know they're infected because they don't look or feel sick. Approximately 75 to 85% of people who become infected with hepatitis C virus develop chronic infection. Hepatitis B and hepatitis C symptoms can include fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, clay-colored bowel movements, joint pain, or jaundice. HIV is the human immunodeficiency virus. It's the virus that can lead to acquired immune deficiency syndrome, or AIDS. The HIV virus was originally identified on December 1, 1981. An estimated 25 million people have died from HIV-related causes since the beginning of the pandemic. The HIV virus attacks and suppresses the immune system, reducing a person's ability to fight infection. The virus specifically targets the cells crucial for fighting infection from pathogens. This allows diseases and infections to progress without resistance. Within a few weeks of being infected with HIV, some people develop flu-like symptoms that last for a week or two, but others have no symptoms at all. People living with HIV may appear and feel healthy for several years. However, even if they feel healthy, HIV is still affecting their bodies. Untreated early HIV infection is also associated with many diseases, including cardiovascular disease, kidney disease, liver disease, and cancer. HIV symptoms include enlarged lymph nodes, fatigue, frequent fevers, persistent or frequent yeast infections of the mouth or vagina, persistent or frequent skin rashes, short-term memory loss, weight loss, and enlarged liver and spleen. Presently, there is no known cure for HIV. Although the life expectancy for HIV-infected individuals has increased due to recent advancements in treatment, the end result of HIV and AIDS is premature death. Of the three major bloodborne pathogens, hepatitis B virus is the most contagious. Approximately 33% of individuals exposed to hepatitis B virus will become infected. Of those individuals exposed to hepatitis C virus, only about 2% will become infected. Comparatively, HIV is much less contagious than either form of hepatitis. About 0.33%, or 1 in 300 people exposed to HIV, will become infected with the virus. The transmission of bloodborne pathogens from one person to another occurs through the transfer of infected bodily fluids. Common body fluids that can transmit pathogens include blood and cerebral spinal fluid. Semen and vaginal secretions can also transmit bloodborne pathogens, but only during sexual contact. Other body fluids such as tears, urine, feces, sweat, saliva, vomit, nasal secretions, etc. do not pose a risk unless visible blood is present. When in doubt, it is best to protect yourself from all bodily fluids. The primary ways bloodborne pathogens are transmitted in an occupational setting are puncture wounds from a sharp or contaminated object, such as bloody broken glass, from a splash of blood to the mucous membranes, and open skin that comes in contact with blood. Common non-occupational ways bloodborne pathogens are transmitted include sexual contact, sharing hypodermic needles, and unsanitary tattooing or body piercing. A written exposure control plan outlines the strategies necessary to eliminate or minimize employee occupational exposure to bloodborne pathogens. This site-specific plan identifies all employee classifications which have occupational exposure to bloodborne pathogens and other potentially infectious materials. This excludes Good Samaritan activities. The written exposure control plan must be accessible to all employees. It must be reviewed and updated annually, or when alterations in procedures create the possibility of new occupational exposures. District-specific information such as the name of the overseer of your district's plan and the locations of your district written plan will be provided to you in a supplement to this video. Employers must identify job classifications in which employees have occupational exposure, as well as the associated tasks and procedures in which there is a potential of exposure to blood or other infectious materials. The two essential practices employees use to eliminate or minimize the transmission of bloodborne diseases in the workplace are engineering controls and work practice controls. Engineering controls are all about the equipment used to minimize exposure. This includes the use of a sharps disposal container, self-sheathing needles, sharps with engineered injury protection, including non-needle sharps and needleless systems. Work practice controls are all about how tasks are performed to minimize exposure. This includes taking universal precautions, like treating all blood as infectious, or when possible, allowing an injured person to help him or herself. Work practice controls also include hand washing, sharps disposal, and contaminated material cleaning. Personal protective equipment, or PPE, is specialized clothing or equipment that protects you from exposure to blood or other potentially infectious material. Examples of PPE include disposable gloves, gowns, protective eyewear, and mouthpieces and resuscitation devices. Non-latex alternatives will also be made available to employees who have allergic sensitivity to latex. Employers must provide and replace this equipment as needed. Replace your gloves if they are torn, punctured, contaminated, or if their ability to function as a barrier is compromised. Remove contaminated gloves by turning them inside out. Be careful to prevent any splashing or spraying of potentially infectious material. You should always wash your hands after removing your gloves, even if you don't think they were contaminated. Also, use a disposable ventilation mask or shield with a one-way valve to prevent an exposure when performing rescue ventilations during CPR. It's common for patients to vomit during CPR due to excess air in the stomach. Your employer must offer you a hepatitis B vaccination series if you have a risk of occupational exposure to blood or other potentially infectious materials, and your employer must pay for the cost of the vaccination series. The hepatitis B vaccine is very effective in protecting against the hepatitis B virus. Approximately 97% of people who receive the vaccine will become fully immune to the virus. It's given in a series of 3 shots, and the entire series of shots is required to provide full immunity. No booster shots are required, and the vaccine is safe with very few adverse reactions. The first injection can be administered at any given time. The The second injection must be given at least 1 month after the first, and the third injection must be given 6 months after the first. A licensed physician or other healthcare professional will perform or supervise the vaccinations. Your employer does not have to offer you the vaccination series if you have previously received the complete series or have tested as immune to HBV. Designated employees must sign a consent form to get the vaccine or a declination form if they don't want the vaccine. If you initially decline the vaccination for hepatitis B, you can later request it from your employer at no charge. The vaccine does not contain blood products, and you cannot get hepatitis B from the vaccine. Although uncommon in a school setting, when an exposure occurs, immediate self-care is the highest priority. Flush potentially contaminated materials from the mucous membranes of the eyes, nose, and mouth with large amounts of running water. Allow a puncture wound from a potentially contaminated sharp object to bleed, and wash the wound with soap and water. Wash potentially contaminated material off your skin with soap and water as quickly as possible after an exposure. Washing is especially important when you have cuts, rashes, or scrapes on your skin. After self-care, report the exposure incident to your school nurse or supervisor without delay. This allows for timely medical evaluation of the exposed employee and testing of the source individual if they consent. You'll be directed to a healthcare professional for medical evaluation as soon as possible. The evaluation will document the route of exposure and how the exposure occurred. There's no cost to you for this evaluation. It's of the utmost importance that infectious waste be safely contained. Infectious waste should be placed in specially designed containers constructed to contain the contents. The containers need to be leak-proof, labeled or color-coded, and closed prior to removal to prevent spills. If a container is leaking, place it in a secondary leak-proof container. Types of infectious waste that require special handling include used and unused sharps and sharp objects, like needles, lancets, syringes, and bloody broken glass. Materials completely saturated with blood to the point of dripping. Any materials once placed in a red bag and labeled as biohazard or infectious waste. Types of waste that go into the regular trash include bandages and gauze pads which are tinged with blood or other body fluids, used tissues from bloody noses and mucus from blowing noses, feminine hygiene products, and preserved animals used for educational purposes. Those should be wrapped in newspaper before being thrown away. Pick up potentially contaminated broken glassware using mechanical means only, such as tongs, forceps, or brush and dustpan. Never use your hands, even if you're wearing gloves. Contaminated items should not be stored or processed in a way that requires you to reach into containers. Work practice controls should be established to prevent you from reaching into a container to remove potentially contaminated items, such as glassware or needles. All equipment and work surfaces that are contaminated must be cleaned and then disinfected while wearing PPE. You should use a 1 to 10 dilution of bleach to water, an EPA-approved disinfectant, or 70% or greater isopropyl or ethyl alcohol. District-specific information like the name of the disinfectant your district uses will be provided in a supplement to this video. Signs and labels that alert you to the presence of potentially infectious material and the risk of exposure are vital to a workplace with occupational exposure to potentially infectious materials. Properly indicating contaminated material using signs and labels will greatly reduce the risk of accidental exposure to the contaminated material. A biohazard label or sign should be attached to each object or container of contaminated material. When red bags or containers with the biohazard symbol on them are used, a sign or label is not necessary. District-specific information such as name and address of school-approved physician to see post-exposure, procedures to follow for an exposure occurring off-school grounds, locations of personal protective equipment, and the process for obtaining your hepatitis B vaccination once consent has been signed will be provided in a supplement to this video. This concludes your training on bloodborne pathogens. Thank you for watching.